Just a few remarks. On behalf of the Gordon and Betty Moore Foundation, I want to, first of all, thank all of our presenters for sharing your really pioneering work with us. You are the early change agents, and we need more of those. And I want to thank our audience for being with us. We've had a very engaging discussion over the last day and a half, and I've certainly felt it to be very productive. I hope you did too. And lastly, I really want to thank our colleagues from the Informed Medical Decisions Foundation for planning and organizing this really terrific meeting. Now, at the Moore Foundation, we believe that meaningfully engaging patients and families is what will help us eliminate preventable harm, and to do that in a redesigned and supportive healthcare system. And we believe this because there's already considerable evidence that meaningfully engaging patients and families helps us achieve the triple aim of better care, better outcomes, and lower costs. Patients with chronic diseases who are engaged are more adherent, they're more likely to engage in self-care, and they achieve better health outcomes. Patients who receive high-quality information and participate in making choices about their care often make different choices than uninformed patients. They often have lower costs, and they're more satisfied with the process. And the interesting thing about all of this is that we've generated all of this knowledge in an environment where the incentives aren't aligned. So just imagine then for a moment what we could accomplish if the incentives were aligned. Now, as we've learned over the last day and a half, this is not just about rewarding meaningful engagement, it's also about removing disincentives to patient engagement. But while financial incentives are an important lever for change, it's also not the only thing. What we've been talking about really is a much broader cultural change. And I think it's important for us to remember that this is an entrenched culture, and it's tenacious and sticky, and changing it's not going to be easy, but we can do this. And there do appear to be a few things that people can agree on that can facilitate culture change. Now, appealing to the inner virtue of healthcare providers is probably not going to be the effective way to do this. Instead, what we really need to do is convince providers that their colleagues are learning how to do this well, and that they all are doing this, and that they want to be doing this because they don't want to be the laggard. We need to create the impression that this is what really needs to happen and we're all going to do this. So this convincing of providers, of organizations, making engagement the new norm is also going to require leadership inside of healthcare delivery organizations, and we've heard over the last day and a half about organizations that are doing this. More of them need to do that. But it's also from leadership from organizations that are represented here at this meeting. So as you leave today and go into the holiday weekend, we hope that you'll be thinking about how your organization can play a role in helping us align the incentives and really facilitating and enabling this culture change. Meaningfully engaging patients and families can solve the key problems that bedevil healthcare. And at the Moore Foundation, we believe that we must strive for nothing less. So I thank you for your participation and for your leadership.
Well, thank you, Dominic. And I'll add my thanks to all our presenters and our audience for getting so many ideas on the table of how we can go from the pilots, the small randomized trials, to the kind of scalability we're beginning to see with implementations like group health and the plans that you're hearing from the High Value Health Collaborative. I want to recruit your help after the meeting, just as Dominic says, but also in helping us shape an action plan for how we move forward. We've taken notes. We'll assemble those good ideas, but other things will occur to you. We can modify and improve that list and action plan going forward after the meeting. So we'll be circulating to the participants here our assembly of ideas, and we'd really like your help not only describing the action plan, but then figuring out how we're going to put the action plan into place. We've been at this for 24 years at our foundation, and it's feeling more and more like we're getting to a tipping point that meaningful engagement of patients and families is right here. We've all made it clear, and it was emphasized again by our patient representatives here at the meeting, that the patients aren't the problem. We got to get the rest of the system lined up for them, because the system is for them. And that's what keeps us motivated here at the foundation. I want to give a particular thank you to my team at the Informed Medical Decisions Foundation for just putting the meeting together. I'll particularly, and everybody's part of it because we're a small foundation, but I particularly want to acknowledge Meg Bowen, Steph Sinaraki, Jessica Rollins, Claire Anderson, and Karan Singh. Could you just stand up for a sec here? Many, many thanks. And again, a special thank you to the Gordon and Betty Moore Foundation for making the meeting possible and to working with us all in moving forward in meaningful patient and family engagement in healthcare. And I'm going to end by thanking you once again, wishing you safe travels, whether it's around the corner or in some cases around the world. Great having you here, and again, you'll be hearing back from us, and thanks for being a part of this important mission.